Hey everyone, welcome to our week 8 recording, reviewing week 7. Just a quick reminder, this week is short. It ends on Friday, so please make sure that you get your papers and assignments, whatnot, in by Friday, 11:59 RMU time. We'll quickly just go over the discussions. We talked a little bit about Medicare Advantage plans. As I mentioned in the classroom, I think these are going to continue to change radically. I think that it's going to be based mainly on the political climate, but I think that I think Medicare Managed Care is a great option for seniors that those that it's appropriate for. I think that there are problems with the insurance broker industry. I think that there's a lot of unethical dealings in sales to seniors that don't understand plans, and they're being roped into plans they don't want or don't understand necessarily. But outside of that, I think the Medicare Advantage program is a great option for many. But I think that that it needs to be a better regulated service. And I think that it needs to evolve. I think that there's more. I think there's more that needs to evolve in that program, and I think we'll see that as it continues to grow, especially with accountable care organizations and more patient-centered medical homes. I think that program will continue to evolve and change, hopefully with the entire healthcare system as a whole. So I think that will continue to change and evolve, just in general, we may see it change with revisions to the Affordable Care Act, etc. The other question about horizontal and vertical equity, I think that it's generally it's interesting to consider horizontal and vertical equity from a financial perspective, economic perspective, but then also consider it from a care and access perspective. And I talked about that in the classroom a little bit. Obviously, in this case, we're considering the economic perspective of this issue, but I think it's interesting to consider it in a couple different ways. So I had just mentioned that in the classroom as well. So let's take a look at the quiz. Get into the quiz here. So the first question on the quiz had to do with means-tested public insurance. So explain the concept of means-tested public insurance. So when we talk about something being means-tested, it means that in order to have access to it, whatever it is, you'll have to provide information, prove your the level of means that you have. So in this case, this is a public insurance plan, so you will have to prove that your income levels meet and asset levels meet the requirements. So in this country, the public insurance that is means tested is the Medicaid program, and there are very specific, state by state, they vary, but there's a federal set guideline, and then state by state they can set different guidelines for different programs. But Medicaid and the CHIP program as well, Children's Health Insurance Program, is also means tested. But those programs are you have to provide proof of your income, proof of your assets, and by providing this information, you are given access to that public insurance program. Now that's what it is in this country. Other countries have different types of public insurance programs that could be means tested as well. Public insurance in this country that is not means tested is the Medicaid or the Medicare program. So Medicare is not means tested. You receive access to the Medicare program in a few different ways. You can receive it through disability. So if you're disabled, if you have end-stage renal disease, you receive access to Medicare, or when you reach the age of 65, you receive access to Medicare. If you meet certain criteria, you have to. There's certain criteria. You have to work a certain number of hours, et cetera, or you have to be self-employed and paid into the program, et cetera. U.S. citizen, there's criteria you meet. You don't, just because you live in the United States doesn't mean you get access to the Medicare program. But generally, most people get access to the Medicare program either through themselves or through their spouse. If you didn't work but your spouse worked, you get access. So Medicare Part A, you receive access to for free if you paid in. Medicare Part B, you have to pay premiums for. Now those premiums that you pay, Medicare Part B, if you there's a certain highest level of premium, but there is a sliding scale on those premiums, and that's means tested. So you can receive a lower premium for Medicare based on your means. So that is actually kind of a means-tested public insurance aspect to the Medicare program. And then obviously Medicare Advantage is Medicare Part C, and part elements of that are Part D as well. So, but those are all not means-tested with the exception of the sliding scale and the premiums. Medicaid and the CHIP program, Children's Health Insurance Program, in the U.S. is means-tested public insurance programs. So the second question, explain the concept of transaction cost in the supply of public health care, or in the public supply of health care. So I'm going to bring up this slide here. This is from our textbook. So transaction cost, and this was obviously just straight from the text. Transaction cost is about administrative cost. So, let's relate it back to what we were just talking about in the Medicaid program. So, administrative cost, let's say that, it costs, we have a claim, and let's say this claim overall is $25. It costs $25 for this claim. And so we're paying out $23 on the claim, and it costs $2 to process the claim. So the overall cost is $25 to the organization, to Medicaid. So $23 being paid to the provider, $2 in administrative cost. So what is administrative cost? That's the cost of everything. Overhead, cost of whoever's processing the claims, all of that extra cost. So all of those things go into administrative cost, and that is, that's important to us in the kind of the public insurance sector, because there's an important societal objective being met here. We're providing insurance to those that wouldn't otherwise have it, because we're talking about Medicaid. So we want to provide them with this care and coverage because they wouldn't otherwise have it. What's important, though, is that we monitor that administrative cost. So let's say right now it's costing $25. We look at this 6 months from now, and now all of a sudden it's costing $45. We look at it, and we're still only paying the provider that $23, but our administrative costs have jumped. So we need to look at it a little more closely and say, why do our administrative costs go up so much? And that's when we may need to make changes. It makes reference in here a different ownership form. Maybe we need to make changes in our processes. Maybe we need to decrease that administrative cost. Maybe we need to privatize. Maybe it's being managed publicly. Maybe we have government workers managing claims, but maybe we need to privatize that. And that's like, we can look at the difference between the way that I'm trying to think of different organizations, public and private, like they're all contracted, though. I can't, like, I have things rolling through my head, but none of them are working out to be to be a good example. But maybe a government agency is processing claims, which would normally be the case. But maybe there's, New York State actually operates a claims processing, function, but now we're going to privatize that. So we're going to actually hire an organization. We're going to send it out to bid, and we're actually going to have a private contract to process these claims, and it's going to be ultimately cheaper. And that's what Medicare does. Medicare has contractors that do all their claims processing. Even for traditional Medicaid or Medicare, they have contractors, Medicare administrative contractors that do all of their claims processing operations. So it's, maybe by changing that ownership form, it would actually make things more efficient and drop that administrative cost back down, because we need to achieve that societal objective. So transaction cost, very important. We need to keep transaction cost low. In this case, we don't necessarily need that equity. We don't need to own that process. We need to keep that transaction cost low. Now, because this is a public health insurance plan, in this case, we don't care about owning the process. We care about efficiency. So hopefully that makes sense, and hopefully I didn't confuse it anymore. But I just wanted to try and, we really want to achieve the societal objective. We want to make things efficient. And in some instances, that's when it makes sense to farm out a process, because a private insurer or private organization can process claims, can do other things at a more efficiently and more cheaper, at a better cost than what we can do things in-house as a government agency. So hopefully that makes sense. I think that's all I have for this week. And so it's been a pleasure working with everybody. I look forward to looking at everybody's projects this week. If you have, or this coming week, if you have any questions as you're working on them, please let me know. I look forward to working with everyone again in the future on in a project or a class. And like I said, any questions, let me know. But otherwise, enjoy the rest of your summer. And there's a little bit of time left before the fall. Best of luck to everyone moving forward. And, happy summer. Thanks so much.